El señor Miguel Jaramillo es el director ejecutivo e investigador principal del Grupo de Análisis para el Desarrollo GRADE. Es licenciado por la Pontificia Universidad Católica del Perú. Realizó sus estudios de posgrado en Economía e Historia de la Universidad de California en San Diego, donde obtuvo el doctorado. Ha sido viceministro de Promoción Social en el Ministerio de Trabajo y Promoción Social. Además, fue profesor de la Pontificia Universidad Católica del Perú, Universidad del Pacífico, Universidad de San Diego, la UPC y Universidad de Piura, e investigador visitante en el Instituto del Desarrollo Económico de Alemania. Es miembro de la Comisión Consultiva de Promoción del Empleo y Capacitación Laboral y del Consejo de la Orden de Trabajo del Ministerio de Trabajo, además de miembro del Consejo Directivo del Senati, presidente fundador del Fondo Empleo y miembro del Comité Ejecutivo de la Red de Desigualdad y Pobreza de la CEA.
Bienvenidos todos y todas a esta sesión. Es para mí un enorme gusto presentar al profesor Paul Gertler. Bienvenido, Paul. El profesor Gertler es doctor en Economía de la Universidad de Wisconsin y es reconocido a nivel mundial por su trabajo en evaluación de impacto. Es uno de los líderes en la investigación de evaluación de impacto. Actualmente es profesor de Economía en la Universidad de California en Berkeley, donde trabaja en la Facultad de Negocios Haas y en la Facultad de Salud Pública. Asimismo, es director del programa de posgrado en Gestión en Salud y director científico del Centro para una Acción Global Efectiva de dicha universidad. Antes de entrar a Berkeley, ocupó cargos académicos en Harvard, en Rand y otras prestigiosas instituciones. Ha sido también economista principal de la Red de Desarrollo Humano en el Banco Mundial, además de presidente fundador de la mesa directiva de la Iniciativa Internacional para la Evaluación de Impacto. Felizmente no me han pedido que lea sus publicaciones, que son demasiado numerosas, nos acabaría la mañana si trato de mencionarlas. Diré nada más que ha publicado sus resultados tanto en revistas científicas del más alto prestigio, como en revistas también de políticas. El rango de temas que ha abarcado su investigación incluyen desde desarrollo en la temprana edad, educación, salud, energía y cambio climático, vivienda, reducción de pobreza, así como agua y saneamiento. Es autor del libro Evaluación de Impacto Aplicada, publicado por la editorial del Banco Mundial. En 1996 recibió el premio Kenneth Arrow al mejor artículo en Economía de la Salud. Les pido a ustedes un aplauso para darle la bienvenida al profesor Gertler.
Gracias, Miguel. Muy buenos días a todos. Me alegra regresar a Lima. Trabajo aquí. Este es un lugar muy interesante en esta parte del mundo. El gobierno peruano es un ejemplo muy bueno en el uso de evidencia rigurosa, tomar decisiones políticas públicas. Okay. Ahora tienen un piloto en mi español. Y esta es evidencia que sería mejor para todos, para bienestar de todos, si hablo en inglés. Okay. I'm going to give really a very personal introduction to impact evaluation. So I titled my talk after The Hobbit, there and back again. And really how I've found impact evaluation useful. And I thought I would start really with how I got into the business of doing impact evaluation. So way back in the middle of the last millennium, when I got my PhD, my doctorate at the University of Wisconsin, in the United States, what you do when you get your PhD is you go out and get an academic job as an assistant professor somewhere. And the goal of an assistant professor is to get tenure. And tenure means that you can live happily ever after without threat of being fired. And the way you do that is you work really hard for 6 years, publish scientific articles in journals, and then your colleagues get together, review your record, decide you're good enough, and you don't make them sick so that you can have the office next to them for the next 30 years. So when I started out, I got a job, and I immediately took a vacation and went to Indonesia and was lying on the beach in Bali. Bali's a wonderful island. And on that beach, with my coffee, I picked up the English language newspaper, the Jakarta Post, and the headline of the Jakarta Post was, "World Bank congratulates Indonesia on model family planning program." And as you read down the article, it said Indonesia successfully reduced fertility from over 6 live births per woman down to below 3 in a 15-year period. And then it went on it quoted a World Bank publication. Other governments should model their programs on Indonesia's experience. So I thought, aha, here's a big public policy issue. Maybe what I should do is go get some data and validate quantitatively that what the World Bank claimed about the Indonesia government was true. So I went to Jakarta, I found the Demographic and Health Survey, which had data on 15,000 women, their contraceptive use histories, their marriage histories, their fertility histories. And I went to the National Family Planning Coordinating Board and matched in data on all programmatic activities. I put all of that data into my very fast computer, which was an IBM 8088 at the time. And several days later, when the results popped out of the computer, we found something quite interesting, which was the reduction in the fertility decline was not explained by the family planning program, but really over that period, there was an expansion of 2 things. One was the government had mandated that that everybody, including girls, had to finish primary education. So at the beginning of the period that the World Bank did their analysis, women or girls who were of fertile age, 15 to 49, they were mostly had 1 or 2 years of education. And by the end of that 15-year period, most of the girls had completed primary or better. Second, in the middle of this period, there was a big increase in oil prices, and Indonesia, being an oil exporter, had a big economic boom, which increased the demand for labor. So who was not working what was the source of this labor? Well, it was getting women to enter the labor force into formal jobs. And so over time, let's say you're looking that way, over time, the male-female wage gap declined. And so it was really the empowerment of women through better education and better labor market opportunities which explains 70% of the decline in reduction, and the family planning program only explained about 5%. And so this was wonderful, right? I could write a scientific article which not only demonstrated the importance of female empowerment, I could start out and I could say the World Bank was wrong. So there's nothing better for an academic than to use the World Bank as a straw man. So I wrote this article, I published it in a scientific journal, and I got tenure, and this article was cited as one of my better and most important studies. And they cited in that tenure review that dozens of people had read that article, and so it must have been very influential. And so now I'm in my office, having tenure, living happily ever after. I arrive about 10, I get my coffee, I read the New York Times, and at about 11 o'clock, the phone rings. Hello, is this Paul Gertler? Yes, it's Paul Gertler. Hi, are you the Paul Gertler that wrote that article in Demography about Indonesia's family planning program? Yes. Well, do you believe the results? I said, yeah, I believe the results. You know, it was published in a great journal, it was good methods, good data, and as my grandmother would say, what's not to believe? And so he said, that's great. Based on your article that the family planning program did not affect fertility, I'm going to cancel a $1 billion loan to the Indonesian government. Well, wait, let's talk about this a bit. And so we reviewed the evidence and what they wanted to do and shifted the loan from contraceptive subsidies to really focusing on girls' education and empowerment to try and reduce fertility even more. So I learned a number of things from this early life experience. One was that the types of work we do in academia, the types of rigorous studies we do, can have big impact in public policy. One was it can be communicated in ways to people who make decisions that help them make better decisions. The second thing I learned was the type of humor, the types of jokes we have in academia are somewhat misguided. So what do academics do? Well, we do a lot of eating and drinking. So we go out for lunch, and typically what we do is we gossip about other people's research. And no one will have read the paper, but we'll say, there's this study written by someone else, and we know that guy, he probably didn't do it right, and here's what was likely wrong. And then someone will end the conversation, will say, oh, you know, that paper, it just isn't very good academically, but it's probably good enough for policy. And that's exactly wrong, right? All of you in this room are in jobs where the decisions that you make affect people's lives. Whether you should expand a sewage pipe, you should have a hand-washing promotion campaign, you should disinfect water supplies. All of that affects people's lives in a big way. And so you would like to know, you need the best evidence as to what works and what doesn't. So in Bolivia, there was a major movement to disinfect water using this program called SOLAS, which was basically to convince people to take water in plastic bottles, put it up on roofs, and then sunlight would disinfect all of the water. Well, in the laboratory, it worked really well, but in practice, it did nothing. And so there are lots of cases where what we think works in the lab or what's common wisdom, but when we get to the field, just don't work. And you need to have the information about what works and what doesn't in order to move money from bad programs to good programs that improve people's lives. So this experience in Indonesia led me to realize that I could work in program evaluation or impact evaluation. It would be good for my academic career so I could live happily ever after and have plenty of lunches. And two, it also would allow me to generate evidence that governments and programs could use to improve their public policies and hopefully raise the standard of living, well-being in the countries that we work in. Okay, so this morning I'm going to take a little bit of time and I'm going to try and answer three questions. Well, what is impact evaluation? Why is it different than other types of evaluations? Why is impact evaluation valuable? And what makes a good impact evaluation? Most of the stuff that I'm going to talk about was not generated by me in my academic hat, but really from a period in which I stepped out of academia to be chief economist for human development at the World Bank. And I remember getting this phone call. You know, I'm sitting in my office drinking coffee, reading the New York Times, and the phone rings. And I'm talking to this vice president for human development. And he says, well, why don't you why don't you apply for this job as chief economist for human development? And I said, well, why do you want, you know, a pointy-headed academic who's never been involved in an operation, never had much interaction with governments? Why do you want an academic to come into this role where you are developing policy for the World Bank? And he said, well, I would like to create or develop an evidence base for the policy advice that we're giving our countries. And I said, aha, that sounds really interesting. in the back of my mind, I said, I was thinking, well, if they want to develop an evidence base for policy advice, what have they been basing policy advice on up until this point? But I didn't ask that question. And so I took this job, and I spent 2.5, close to 3 years riding the wave of impact evaluation in the World Bank, where we work to embed evaluation into operations so that we learn something from every operation, and every time we come out of the field, we could learn something to improve policy for that government and build the body of knowledge about what works and what doesn't, so that when we engage with other countries, we have evidence about what works as opposed to theories about what might work. And today, not only in health and education, but in infrastructure and specifically in water and sanitation, there's a major movement not only within the World Bank, but really worldwide to not only generate evidence, but generate an evidence in a way that's useful for decision makers and helping make that translation. So a lot of the answers that I'm going to talk about in the next few minutes to these questions come from the experience in working in about 30 countries since I was lucky enough to get that job. Okay. So what is impact evaluation? Impact evaluation is really an assessment of the causal impact of a program or a policy on some indicator of welfare of the population who hopefully benefits from that program. And really the key issue here, or the key definition, is that the changes outcomes can be attributed to that policy or intervention. And that's going to be crucial because we're going to want to separate out changes in the outcome which are correlated with the intervention from changes in the outcome that are caused by that intervention. In fact, in my early example about Indonesia, the reduction in fertility in Indonesia was correlated with the expansion of the government's the government's family planning policy, but it wasn't caused by it. It was caused by the empowerment of women. And that's very important, because if we don't know that the program caused the change in the output, then we can't use that evidence to scale it up elsewhere or to change the program. Okay, so here are some examples of the types of questions that impact evaluation answers. What is the effect of information on hand washing hygiene, and child health? So how did a health promotion campaign change behavior and ultimately health outcomes? Does paying primary healthcare workers for performance improve access and quality? Do early childhood education programs improve subsequent learning? Does the expansion of urban sewers reduce open defecation and improve health? So all of these questions are, what is the impact of providing some program or intervention on the behavior and outcomes of the beneficiary? Okay. So in general, we can ask questions like, what was the effect of the program on outcomes? How much better off are the beneficiaries because of the program? How would the outcomes change if we change design? Is the program cost effective? Traditional monitoring and evaluation cannot answer these questions. Traditional monitoring and evaluation looks over time and asks, was the program implemented as designed, and how did outcomes change over time within the group of beneficiaries? The problem with using the change in outcomes is that many other things change over time as well. So if we see a expansion of a clean water program and diarrhea goes down, was that due to the clean water intervention, or was it due to a change in the environment in terms of it's drier? Or was there at the same time an albendazole deworming campaign which might have reduced diarrhea as well? We can't separate out the impact of the program from other things that are changing over time within traditional monitoring and evaluation systems. Okay, so that's what impact evaluation is. Let's turn to why impact evaluation is valuable. And in my experience, there are really three areas where we've seen impact evaluation affect public policy. Now, I want to be extremely careful. There are many other things that go into public policy decisions. These are areas where the evidence from impact evaluation has mattered, along with all the other considerations that government decision makers have to make. And those three areas where evidence seems to matter a lot are funding decisions. Really, that's the question of sustainability, right? Everybody here who's participated in writing a loan document has this section on sustainability of the program. And there are lots of fancy international speak terminology associated with sustainability. In my mind, sustainability means that someone who has money believes the program is important enough to continue to pay for it, whether it be out of policymakers and the Ministry of Finance out of national budgets, users through user fees, or somehow you happen to catch Bill and Melinda Gates on a good day and they decided to put their money into it and make the program sustainable. The second area where it turns out to be quite important is in program design. The government has decided to scale up a program or has a program. It doesn't want to take that program away, but it wants to make that program better. So, for example, we have already invested in sewer and water lines in urban areas, but the connection rates are low. How can we develop policies to improve the connection rates? Maybe through subsidies, maybe through information campaigns, things like that. And finally, while we think about impact evaluation and the evidence that's being generated to being used as inputs into local policy, really, the biggest impact has come from influencing ideas, contributing to the body of knowledge, and to the wave of opinion as to what the new thing is in terms of providing evidence to other governments. And that works in large part through international agencies aggregating what we've learned across many countries and using that to prevent evidence to governments of saying, this has worked in many other places, it's something that you should try. Or what you're considering has not worked, and therefore you might not want to try it. So let me give you a few examples in each of these categories. Okay, so funding decisions. The one I'm going to start out with, even though I'm going to give some non-water and sanitation examples, but this is one I was lucky enough to be involved with. Like most things that I'm involved with, it starts out with a phone call, me reading a newspaper and drinking coffee in my office, and the phone rings, and this was in 1997. And then director of the Mexican budget director, Santiago Levy, calls and he says, hi, can I speak to Paul Gertler? Yes, this is Paul Gertler. And he says, have you ever worked in Mexico? I said, no. Do you speak Spanish? No. Have you ever visited Mexico? Well, I've been to Cancun. He says, good, you've never been to Mexico. And he says, we need your help. We've got this new program, and we'd like it evaluated. And I said, okay, so what's the program? He says, well, when our president, Ernesto Zedillo, was elected, we decided to make a major commitment to reducing poverty. And in the middle of our administration, we've come up with this idea called a conditional cash transfer program. Then it was called Progressa. Its name has been changed a number of times. And I said, well, what's the idea behind this? He says, well, we'd like to break the intergenerational transmission of poverty. We don't believe that there's too much we can do for the current poor because they're very uneducated, they've got health problems, And so while there's some things we can do to improve their outcomes, what we really want to do is take their children, get them better educated, better nourished from the start, and well educated. So what we're going to do is we're going to create this cash transfer program, but we're going to condition it on pregnant women going for prenatal care, bringing their children in for growth monitoring and nutritional supplementation, and on keeping your kids in school. And I said, well, that sounds great. And he said, the issue is that this program has a long time before it will have its ultimate impact. We're going to take children from conception all the way through secondary, all the way through high school. So a family really needs to be on the program 12, 15 years before it will have its full impact, before we'll see improvements in human capital of a generation that will give them the capabilities to take advantage of labor market opportunities and pull themselves out of poverty. So I said, that's great. Now, I really don't know what you want us to do. And he said, well, Mexico has a government where the president is only elected once for 6 years. We're going to be starting this program in year 3 of his administration. So really only have 2.5 years of exposure, not a full 15 years before the government has to change. And the problem in Mexico is the people who run for president always start out by saying the last president was a bum and didn't know what he was doing. And all of the social policies in particular were wrong. And so there's a history of a new administration comes in, they close social programs and start new social programs fresh. And he said, if this idea of a conditional cash transfer program is going to work, it really needs to be sustainable across political administrations. And so the audience for this impact evaluation is really the next government. And so we said, okay. So there was a team of people of international experts and local academics got together. We randomized, we measured, we followed 24,000 households, we sliced, we diced, we ironed, we tied, and we finally got results, and the results were very positive. After 2 years, children were taller, they were more likely to be in school, they learned more. Families were taking some of the cash benefits and investing them in cows and chickens and looms and other assets that increase income generation. And so we had this nice body of evidence that the first 2 years seemed to be really working, seemed to be moving poor Mexican families on the right path. The new president was elected, Presidente Fox. We went and presented to his advisors, and the advisors went away. They looked at the evidence, they came back, and they said, you know, look, this is very compelling. The problem is during the campaign, we said Progressa was really a bad idea, and that if elected, we would close it. So what are we going to do? We're going to close Progressa, shut the program down, but we're going to open a new program with the same people running it, the same benefits, the same beneficiaries, and we're going to change the name from Progressa to Oportunidades. And so Oportunidades, really the program was sustained in part because of the evaluation, not completely because of the evaluation. It was hard for the Mexican government to take cash transfers away from 5 million households out of 20 million. But the evidence clearly was important in the continued funding of Oportunidades. Okay, so here's another example that we were involved in, and this is a water and sanitation one. Northeastern Brazil is very, very dry, and it tends to be rural, and so it's very hard to bring piped water into northeastern Brazil. The government, along with the Spanish, came up with this solution. Well, maybe what we should do during the rainy season is collect the rainwater from roofs and store it in these cisterns. And so there's the cistern right there. And the idea was if we store it in the cisterns are clean, water coming off the roof is clean, so maybe we'll have drinking water through the 5 or 6 months when there's no rain in northeastern Brazil. So we did an evaluation of this, a nice randomized evaluation. And one of the things we did was we put sensors in the tops of a sample of the cisterns. And these sensors every hour were like sonar finding submarines. So it would have a sound, and we'd know what the water level was every hour. And so we could see how much the rainwater filled these cisterns and how much they used over time. And you can see on the right are graphs of what's happening, and you can see when there's rainfall, they're very high, and then over time they come down. Now, what was interesting is in the middle, we used this data, and what we found was only about 10% of the water in the cisterns was actually filled by rainfall. Most of it was filled by trucks coming around and refilling the cisterns. And it turns out when you did assays, when you did tests for E. coli, contamination of water, what we found was that there was mixed evidence on the contamination. So what happened was is if you were filled by a military water truck, the E. coli was really high. If you were filled by a municipal water truck that came from the municipal taps, the water quality was pretty good. And so what happened was those people who were originally getting their water from the city taps and got their cisterns filled by military trucks, water contamination went way up. If you originally got your water from water taps and you were filled by municipal, it stayed the same. And if you got your water from surface water, which was likely to be contaminated, and you got municipal trucks, you had an impact in water quality. And because the intervention didn't work as designed, there just wasn't enough rain to fill the cisterns, we found no impact on health because some people's water got worse, most people's water stayed the same, and only a little bit got better. And so we found no health impacts. But interestingly enough, the water cisterns not only didn't have an impact on health, but they had impact on families in another way. Well, one was it reduced the time that women had to collect water and clean water, but families seemed to really value having a secure source of water and not have a lot of uncertainty. And so what we found was we found stress and depression falling, and the value of houses went up. So the cistern cost about $1,500, but the value of the houses went up by $4,000. And so there was value of these cisterns not just through health, but through other mechanisms as well. And so if you were to decide whether or not to scale this up based on health, you would say no. But if you were to decide whether or not to scale this up based on benefits to the family, you would say yes. Okay. Another large study that was done which affected decision, in Mozambique, there was a big issue with student learning, with students not doing well in school. So rather than investing in improving quality and teacher training and things like that, the government decided to evaluate a small preschool program implemented by Save the Children. It was extremely cheap because they used community volunteers. And what the evidence showed was that cognitive development, social competence, emotional stability went way up, and kids did better in primary school had they gone to this. This led the Mozambique government to scale up this preschool program countrywide. Okay. So those are some examples of how impact evaluation can affect deciding whether or not to scale up a program, using the initial rollout to do so. A second issue has to do with program design. So this is not an area of should I do the program or not. This is really an issue of how best to design the program to achieve maximum outcome. So, working in Mexico, there was a major decision to try and improve the housing quality of families that live in slums, in semi-permanent slums. And there were two particular programs that the government had and were trying to consider which to scale. The first one was a mejoramiento program, which looked at the existing houses and said, how could we improve them dramatically? And in particular, we looked at one program which replaced dirt floors with cement floors. And the second program was one which created new housing developments, or Tu Casa was the name of the program. The Tu Casa program worked like this. I'm going to go into a municipality. I'm going to identify municipal land. I'm going to build new houses, 34 square meters, windows, ventilation, water, sanitation in the houses, sidewalks, lights. But the new housing is not in the centro, it's really outside of the centro. Okay, so that program was evaluated. And an interesting thing happened was these new wonderful houses were abandoned by 60% of the beneficiaries after the first year. Why were they abandoned? Well, it turns out that most of the people who live in slums are giving up housing quality in order to be close to work. So the jobs are why people move to those locations, and they're willing to live with dirt floors and bad windows and no water and sanitation, because otherwise they can't work. Second, they may have family and friends there who can care for their children when they work, or other people who can provide day laborers information about daily work. And when they moved to these really wonderful housing communities, they found they were very far away from work and very far away from their social networks which provide support. And so they abandoned them. In fact, that's a major issue when we think about scaling up services in urban slums. As we bring in sewer pipes and water, connect to households for indoor sanitation and good water, as we bring in electricity, housing improvements, well, the landlords who own those houses will find them more valuable and raise rents and may push the poor out of those houses. And so when we go to evaluate urban problems, we want to consider what it affects to, one effect on the residents may be to push them out of that housing so landlords can make better rents. Okay, to get back to this problem, so the creating new housing and moving to new housing didn't work, but as an alternative, could we improve people's lives by improving their houses? And what we found with piso ferme, which was the replacing dirt floors with cement floors, it had a major positive effect. So what was going on? This is the government in one state in Mexico, Coahuila, and the evaluation started because the governor wanted to run for president, so he wanted an evaluation of a program he thought worked. So how did it work? Well, children who have lots of parasitic infestations, they play on the floor. Dirt floors, fecal matter comes into the house through animals, through weak diapers. It's hard to see and hard to clean. Children are playing on the floor. They play with their hands. The hands gets in the fecal matter. They put it in their mouth. They ingest intestinal parasites. Intestinal parasites live in their GI tracts. It leads to diarrhea. Parasites eat micronutrients such as iron. That makes the brain less ready for cognitive development. And what we found is when we replaced dirt floors with cement floors, mothers could more easily see the fecal matter, could clean it up. Children were playing less in fecal matter, ingesting less. They were, and when they ingested less, they had fewer parasites, lower anemia, lower diarrhea, and improved cognitive development. And so the Mexican government took these, and the other thing we found was Mothers were substantially happier. One, it was a nicer house to live. Two, their children were healthier, so we had lower depression rates, lower stress rates. And this was used by the government to move from the 30,000 floors that were done in Coahuila to scale it up nationally to replace 3 million dirt floors with cement floors. Okay. A second area where it's been extremely useful to affect program design has been in figuring out how to target the poor. A large number of our policies are trying to get the right programs to the poor. So in water and sanitation, there's lots of movements to subsidize the installation of private household sanitation units, or give households water filtration systems, or target hand washing promotion programs like they did in Peru a few years ago. And so the question is, how do you target these programs to the poor? Well, there are a number of different methods of doing that. One is community-based. We find communities that are poor. We know there are a few non-poor living in communities, but it's okay. We're going to do well. A second one is a proxy means test, like was used in Progressa, which is we go door to door to every household, we collect some information on housing quality, on demographics, and we take those 7 or 8 indicators, construct an index. Even though that's not exact, it's correlated with poverty. And third, we use mechanisms like self-targeting. So you want this benefit, you have to stand in line a long time, or there's a cost that the poor will have to pay that the non-poor are not willing to pay. And the targeting mechanisms, which targeting mechanism we use, is incredibly important, because if our program has very few people that we're offering, our targeting mechanism has few people, it's not effective. If it has a lot of poor but many non-poor, it's inefficient. And so in Indonesia, what they did was, in looking at a program, they decided to randomize different targeting mechanisms to different groups, a community-based, a proxy means test, and a self-targeting. And what they found was, at least for the programs that they're looking at, is the community-based was the most accurate and the most cost-effective. And so the Indonesian government decided to allocate most of its programs using the community-based method of targeting the poor. And then ongoing work directly related to governments in your area has to do with slum sanitation connection fees in Kenya. When we run sewage pipes through urban areas, there's a very large cost to connections, and the program will be ineffective if we don't get households to connect. And it'll be the people who are less likely to connect are the poor. So maybe we should develop a connection fee policy by lowering the connection fee and loading those costs into the monthly fees. Or second, maybe we should just have one-time subsidies. So looking at how subsidies affect the take-up rate is critical to making urban sanitation policies work. In rural areas, it's hard to get water and sanitation pipes through. Instead, we have to rely on rural households to invest in their own private sanitation facilities. One of the big issues with the effectiveness of private sanitation facilities that I may have a toilet and use the toilet, but my neighbors may not. The effectiveness and therefore my health won't be affected, because flies can go from my neighbor's feces to my water and my food and contaminate me. So I'm only protected the extent to which my community all has private sanitation. So how do we do that? Well, the India government tried to give fairly large subsidies to get people to install private sanitation facilities. The take-up rate on that was about depending on the state, between 30 and 60%, but they didn't get close to the community coverage rates they needed to have large impacts on health outcomes. So now we're experimenting with a different types of subsidy, which is I'll give you a subsidy if you build a toilet, I'll give you a bigger subsidy if you and your neighbors all build facilities. So the subsidy rate goes up the more of your neighbors that build sanitation facilities. And the idea is to use social pressure or social incentives to rotate up the demand curve, make it more sensitive to prices. If we do this, we can get much higher coverage rates at lower expenditures. There are also issues in terms of how we manage public toilets, pricing, things like that. And then finally, work on behavioral change, especially around the community-led total sanitation. This is what we're finding pretty conclusively is this behavioral change intervention, community-led total sanitation, doesn't seem to reduce open defecation enough to matter. Okay, so finally let me talk about the last area where impact evaluation has turned out to be useful is a means of influencing ideas. And again, this is probably, in my mind, the biggest impact of impact evaluation on public policy. It's been less effective for the policies that have been evaluated in that time. So I'm running a water program or a hand washing program in Peru. We found that the information about that, while it may have been useful to Peru, is turned out to be much more useful to Bolivia and Argentina and Kenya and India, where we've aggregated the lessons from Peru with the lessons from Indonesia, the lessons from Vietnam, lessons from Tanzania, where we found a common picture. That's been clearly influential in influencing what other governments do, and as such is a global international public good. And here's the best example. So in 1997, there were 2 countries that were doing conditional cash transfer programs like Progresa or Oportunidades in Mexico. The other program was in Brazil. Okay, I remember in 2000, when we had finished all of the studies in Mexico, and I was being invited around the world to give presentations, eat good meals, and drink great wine, stay in wonderful hotels, in order to be involved in a policy dialogue around the world. Because governments around the world were interested in the Mexico experience about the conditional cash transfer program. And one of the places I went early on was Brazil, and I started out talking and saying, Progresa is the oldest and largest conditional cash transfer program in the world, and here's what we found in the impact evaluation. But when I was looking out in the Brazilian audience, unlike everywhere else in the world I had been, no one was smiling. No one was nodding their head yes. They were looking really, really unhappy. So at some point, I stopped and I said, well, look, what's wrong? You obviously are not receiving this information well. And so finally, someone raised their hand and they said, well, look, our program, Bolsa Familia, started 6 months before Mexico's Progresa. And our program, Bolsa Familia, has 8 million beneficiaries, and Mexico only has 5 million. So really what's true is Brazil's program is the oldest and largest conditional cash transfer program. So I said, that's great. Can you show me the results of the evaluation? And the response was, what evaluation? And the results out of Mexico in the early thousands had very large impact on what other countries were thinking because of the results that were coming out of the country from the impact evaluation. Brazil, which really was the oldest and largest program, had less influence early on because there was no rigorous examination of whether it was working or not. All you had were testimonials. And so the weight of evidence from Mexico was much more powerful. Brazil eventually developed an evaluation and became influential as well, but probably about 7 or 8 years after the Mexico evidence was already in the public domain. Today we have conditional transfer programs not only through Latin America, but in many African countries, Eastern Europe countries, and Asian countries. And the evidence that came out of Mexico went to the Inter-American Development Bank, went to the World Bank, went to DFID, and became part of the advice countries were getting through the international agencies, and countries were able to make study tours and things like that. So you here in this room who are involved in innovative policies throughout Latin America in water and sanitation, an area where we have less evidence than in other areas. Many of the interesting ideas that you have, the things that you're trying, not only can benefit your populations in a big way, but if we can get some evidence about what they're actually doing, can have influence worldwide by influencing the body of evidence that everybody looks at to decide what to do. Okay. All right. How am I doing on time? Well, okay. Well, I guess I'm done. Well, let me take 3 minutes and try and finish up. So, all right, let me say these things without the slides. So what makes a good impact evaluation? I said earlier that you don't want to use just monitoring data, which takes the group of beneficiaries and asks what's happening to their outcomes over time before and after, because things change and we can't distinguish why those things change. Was it the program or changes in the weather, changes in the economy, changes in other programs? To have a good impact evaluation, we have to have a control group. We have to estimate what would have happened to the treatment group had they not got the intervention. And that turns out, we're going to talk all week in the seminar for those who are going to do it about how to do that. And there are a number of solutions which come down to either experimental or quasi-experimental methods. Both of these methods come out of the way programs are designed operationally. So there are rules of operation which decide who gets benefits and who doesn't, who gets them first if they're rolled out or phased in, and who gets them later. Who gets them and who doesn't are based on some criteria, and we can exploit those criteria to identify a control and treatment group. If programs are rolled out over time, the groups that get them in the first year can become our treatment groups, and the groups that get them in years 2 and 3 can become our control groups. The question then is, what criteria do we use to roll them out? If we can do that and get involved prospectively, when the program is being designed or a new rollout or a new phase of the rollout or a new benefit is being decided, if we can do that, then the evaluation can always find a good control group. We can always find a good control group if we're in the room, if the evaluators are in the room as the program is decided. If we try and do this retrospectively after the program is rolled out, it's almost impossible to do it. And so one of the lessons on how to do this is bring the evaluators in early. So how do we ensure that, this is the final point, how do we ensure that the impact evaluations actually have impact on policy? Well, we can engage early and we can engage often with policymakers. So I talked about the Mexico example of housing, where we compared Tu Casa, the new houses, to Piso Firme, the cement floors, And that had massive policy influence. The government took the results and scaled it up to 3 million households. I have another evaluation, which is probably my most important academic paper, which looks at the privatization of municipal water and sanitation decisions in Argentina, where they turned over in the 90s the financing and management from municipal governments to private concessions. And there what we found was that it worked phenomenally well, that it led to very large reductions in child mortality, especially in poor areas. But that had no influence. Why? Because when we did this as an academic exercise, the stakeholders were not engaged up front, and they ignored the results when we tried to argue that it was influential to them. In Piso Firme in Mexico's, it was answering a question that the policymakers wanted to do. They had to make a public policy decision, so they were eager for the answers. In Argentina, there was no discussion about privatization or renationalization. That was a decision the government had already taken, and they didn't want to reopen it to evidence that they were not involved in generating. So involving stakeholders at every stage, make it prospective. And I think the message that comes out of this is we need to be on the ground working with interventions to foster relationships, make sure stakeholders are involved and get a good design. But the results can inform decisions beyond the borders of the country. So we need to work locally and think globally in evaluation. Okay. So impact evaluation is useful for policy in terms of resource allocation decisions, benefit designs, influencing global ideas. The way to do that is to start early, do it prospectively, working with governments, build the control groups into the rollouts, and work locally but think globally. Thank you very much.
Muchísimas gracias, profesor Gertler. Al público se le ha entregado una hojita donde pueden hacer sus preguntas. Por favor, escriban sus preguntas en esas hojitas que después las van a canalizar hacia esta mesa para poder formulárselas al doctor Gertler. Yo quisiera hacer un comentario general que vincule las diferentes presentaciones que hemos escuchado hoy día en el curso del día. Más temprano escuchamos de parte de dos altos funcionarios en ministerios claves para la provisión de servicios para el bienestar de la población, el Ministerio de Educación y el Ministerio de Vivienda, sobre cuán útil podría ser el uso o cuán útil es el uso de evidencia, pero también sobre las dificultades que hay en el uso de evidencia para la formulación de políticas. Y los temas ahí son diversos, ¿no? Desde el diferente ritmo que hay en la formulación de políticas públicas e implementación de políticas públicas con relación al ritmo de las investigaciones. En muchos casos, típicamente, si uno comienza a pensar la evaluación de impacto después de que se comenzó la intervención, ya es demasiado tarde, no se va a poder tener la información adecuada para hacer la intervención. Temas de que muchas veces se genera información inadecuada sobre las intervenciones, y también temas de cómo, fundamentalmente, cómo pensar en términos de implementación de políticas con una perspectiva de generación de conocimiento. Esto es partir del punto de vista más bien modesto y quizá ajeno al quehacer político, de que en realidad sabemos muy poco, o lo que sabemos es insuficiente, sobre qué efectos tienen las cosas que hacemos desde las políticas públicas. Entonces, hay una agenda bien amplia para facilitar la transición desde los resultados de investigación, los resultados de las investigaciones de impacto hacia el diseño y la implementación de políticas públicas. En ese sentido, yo tengo una pregunta, profesor Gertler. ¿Cuál sería una métrica sencilla para transmitir el valor, el beneficio de tener información de evaluaciones de impacto para implementar políticas públicas? ¿Cuál le parece en su experiencia, cuál es la métrica más sencilla de transmitir para transmitir este beneficio de tener mejor evidencia a través de evaluaciones de impacto?
So this is a different question than asking how we generate good evidence, because it's quite easy. Well, it's not easy, but it's relatively straightforward how to generate evidence. The question is how do we most easily transmit that information to the people who make decisions is just as important, because if we're unable to provide the information to decision makers who aren't technical experts, then we may as well not have done the impact evaluation. There are a number of things that are quite important. One is, who are you speaking to? So if you are going to someone who doesn't have to make a decision in the area, or has already made the decision, or has strong political reasons to ignore you, then it's likely whatever you say isn't going to matter. So this is why engaging the policymakers up front as you design the evaluations. What decisions do you have to make? What information do you need, do you find that would be useful? So that when you actually generate the information, it's answering the questions that they care about and help them to make decisions. So that's one. The second is, in terms of the methods we use, some methods allow us to very simply display the data in terms of the outcome of the treatment group to the outcome of the control group. Other methods require very sophisticated statistical analysis. So in terms of our choice of methods, if we can use a method which allows us to display data more easily, then it's going to be more effective in communication. And it turns out the easiest way to do that is some level of randomization. So if we're rolling out a program and we're going to do 100 communities this year, 100 communities next year, 100 communities the year after, and all 300 communities are equally eligible, doing a lottery as to which go first, which go second, and which go third allows us to have the simplest statistical analysis and present the way in the data that are most accessible to policymakers. Third, while I'm a quantitative person by and large, the ability to phrase what you've learned in the experience of beneficiaries and clients through qualitative work, one, confirms and deepens what you learn from the quantitative analysis, but it also allows you to tell a story in the context of person that can really resonate with large numbers of people, and that turns out to be quite important.
Muchísimas gracias. Esperando sus preguntas, un tema muy interesante en la exposición del profesor Gertler es los diferentes canales a través de los cuales la evaluación de impacto puede informar las políticas. Desde la cosa muy práctica de tengo que tomar decisiones, dónde invierto dónde puedo obtener el mejor retorno para inversiones en beneficio de la población, hasta temas de cómo, en algunos casos la primera pregunta no es la más relevante. Por ejemplo, un programa de vacunas, uno no se pregunta si lo hago o no lo hago. Un programa de vacunas no se puede descontinuar, ¿no? Y ahí viene un segundo canal donde también la evaluación de impacto influencia las políticas, que es cómo diseño mejor la entrega de las vacunas, ¿no? Y un tercer canal es influenciando ideas en general. O sea, en muchos casos, las evaluaciones de impacto o ya se tiene evidencia de otras evaluaciones de impacto que alimentan cierto conocimiento común. Y en ese caso, una revisión de literatura, una identificación de esa evidencia más relevante, quizás es lo más útil que necesita el funcionario para tomar sus decisiones. Lo que sugiere esto, a mi parecer, es que se necesita una visión estratégica detrás de la evaluación de impacto, ¿no? ¿Qué criterios pensaría, profesor Gertler, que son importantes considerar cuando uno decide este programa debe ser evaluado? De este programa se deben sacar importantes lecciones versus otros programas que quizá necesitan más bien una evaluación de procesos, mirar cómo está avanzando el programa, o programas sobre los cuales ya se tiene evidencia que parece suficientemente fuerte como para tomar decisiones.
Thank you. Those are really a couple of questions. One is, where does impact evaluation fit in all of the monitoring and evaluation that we do? And second, should we evaluate everything, impact evaluation of everything? And if we don't evaluate everything, how do we decide which ones to evaluate? So, one of the areas that used to be quite important that we don't do a lot of now is ex-ante program evaluation. So as we're designing a program, the idea of doing a very careful diagnostic of what the problems are or what the barriers that we're trying to overcome. So, for example, in reducing open defecation, is it really people don't have access to sanitation facilities, or they, for cultural or information reasons, don't want to use them? So whatever the reason is, if it's information or cultural, then we need to involve in behavioral change. If it's not having private sanitation facilities, they're too far away, then we have to make an investment. And so the ex-ante design and work of what's likely to work is really important, and that should always be done. Second is a process evaluation, which is, are we implementing the program in the way it was designed, and are the beneficiaries who should be getting the program actually getting it? So an example is we're looking at a sanitation behavioral change program in Indonesia, and only 60% of the villages who should have been visited were actually visited. And so implementation was quite weak. And when we do the impact evaluation, we find there was no impact. The question was, did the design of the program fail, or was it just poor implementation? So process evaluation is another, and monitoring is also critical to every project and needs to be in every project. Are we implementing the way we should be, and are the people getting the program should? So the ex-ante design and process evaluation, in my mind, are just part of management. If you're in private business, you're running an auto manufacturing business, you're always doing process evaluation. Is my assembly line doing right? Are the process evaluation, are the cars getting to the dealers on time? Things like that. private businesses, this is just a cost of management. And we need to view public policy programs the same way. It's just something we should always do, and it's part of the normal cost of doing business. Impact evaluation is somewhat different. One, it's more expensive. Two, it takes longer. We're not going to do impact evaluation in 3 to 6 months. It's really going to take a year or two minimum. So when then do we invest in impact evaluation? So, and if you're a government, it's a little different than if you're an international agency. If you're a government, the first thing you want to ask is this program a large part of my national budget? Is it affecting a large number of people? If it is, then one, if you spend like Progresa in Mexico, $4 billion a year or half of the social sector budget, you want to be damn well sure it's the right use of money. If it's a small one-time education campaign in primary schools, which is cheap and fast, well, you might want to do that without a large, expensive impact evaluation. So is it a lot of money? Is it an ongoing program? Is it a large number of people? That's question number one. Question number two is there any evidence in a country, in my country, or in a country which has a similar economy and culture that shows the program works or doesn't work? If there is, I might not want to invest a lot in impact evaluation. But if there's no evidence in a country like mine or in my country, then I got to really know how it works. One, if it works. And two, what's the best way to do the particular benefit design? So, for example, in Progresa, they gave cash transfers, which was really quite large. If we did this in Peru, could we get away with smaller cash transfers? Or could we change the conditionality? So even if a program has worked somewhere else, the specific design features, the amount of the subsidy, the type of information, who the beneficiaries are, all of that could be different in your country. And so piloting or evaluating how to make it better, the design in your country, is worthwhile. And then if there's no evidence out there that the program works at scale anywhere, then it's worth doing a small pilot study in your country before you decide to scale it up to 1, 2, 3, 4 million beneficiaries, because it has big consequences.
Muchas gracias por la respuesta. Tengo dos preguntas asociadas a las anteriores. La primera es, ¿cuáles son las 2 o 3 preguntas claves que el sector de agua y saneamiento debería evaluar?
Okay. So we're spending an awful lot of money in infrastructure. Massive amounts of money in infrastructure. Sanitation, sewage systems, water pipelines, all over the place. And we haven't yet thought, I think, carefully about all of the choices that individuals have to make to take advantage of that infrastructure to improve their health. So I showed you in Brazil that the Brazilian government made a massive investment in cisternas to collect water. In fact, the past government, not this election, but the election before, one of the campaign slogans was 1 million cisternas. They were going to invest and give 1 million households cisternas. But it turns out that how you fill the water and making sure the water that goes in is clean. And then when water is taken out, to make sure you maintain the chain of cleanliness from the container you put the water in when you take it out of the cisterna to what you do with that water before it gets ingested by people is just as important to the effectiveness of the cisterna on maintaining health. And I don't think we yet understand, one, how we can help households develop good hygiene and sanitation habits to take advantage of all the infrastructure investments that we're making. So it's the human component of the infrastructure investment. That's one. Two, related to infrastructure, how do we get households connected to all of the water and sanitation infrastructure that we're investing in? So it costs money to connect a sewage system to my house, not only in digging and expanding the line, but I have to have a toilet. I have to have a whole bunch of things in my house. And that's quite expensive for poor populations. So how are we going to get connected? Our government's just going to pay for that? Are we going to use some sort of private public financing, some out of pocket for people, some government financing? Are we going to look for microfinance? Can we take advantage of social incentives? So a big issue in terms of the effectiveness on health is because there's a large health externality that if you have good sanitation and good water in your household, that helps protect me. And so the idea that it's not just the hygiene and sanitation of a household, but really of a neighborhood that matters. How do we get neighborhoods to take up at 70, 80% toilets and water to protect everybody? Well, maybe we need to use social incentives where the subsidy goes up as the number of people are connected, or we have to provide information or other things. So the individual health behaviors, the idea of connecting not only individuals but neighborhoods so we can improve everybody's health. Those individual behavioral issues are two of the most important. And I think, how are we going to manage and maintain public services, whether it be municipal water supplies, household springs and public water and sanitation? If we don't have sewer pipes, how do we have markets for sludge that get the sludge removed? All of those secondary markets. So all three of those issues say it's not enough to invest in infrastructure. We got to get people to use it right. We got to get people to connect, and we need the management systems to make sure they're maintained, and markets to make sure they're clean.
Muchas gracias. Una última pregunta, esta es formulada en inglés. What are the risks of importing programs in terms of the results?
What are the risks of them?
Importing.
Sorry, I don't understand the English question.
Okay. I guess the question is, what are the risks involved in borrowing programs that were implemented in other places?
So lots of times, or almost always, whatever we do in our countries is based on either our own experience or our experience in other countries. So a good example is in the 1970s and 1980s, many countries tried to adopt the US healthcare system, and the US healthcare system is a disaster in the US and also a disaster in the countries that imported it. I think it's important to look at the evidence of other countries, and if we find that a particular type of program has worked in many different settings, high economies, low economies, Western cultures, Latin cultures, Eastern cultures, we can be pretty confident that some version of it is going to work in our country. But the exact implementation has to be culturally appropriate. So, for example, the types of messaging for hygiene information campaigns that they would use in Germany probably wouldn't work in the Andes. We'd want to change the illustrations, change the reasons why, change the terms we use. And so anytime there's an information campaign, it has to be made locally relevant and validated. Second, anytime we have money being transferred, what's the right level of money in our country is going to be different because incomes are different, costs are different, how people's value of these things. So both information campaigns and either subsidies or cash transfers have to be rescaled to the particular country, and that would involve some sort of impact evaluation to do it. I think the biggest risk doesn't come from programs that, once appropriately adjusted to local conditions, have worked in many different countries. It's when we have one pilot done by, say, academics in one small rural district in, say, a place like Kenya, and we take that and say, aha, we should scale this policy worldwide. Then we're at big risk. If it's only worked in one place under ideal circumstances, then we need a full-scale evaluation before we scale it up in our countries, because it just may not work in our country.
Muchísimas gracias. Pido un aplauso para el doctor Gertler por su magnífica charla.